And welcome back. According to the CDC, overdose involving opiates has killed more than 28,000 people in 2014, and half of those deaths were from prescription opiates. Over the years, people have become more dependent on the painkiller, causing a nationwide epidemic. Now joining us in the studio to share some insight on the drug is the medical director of addiction at St. Barnabas Hospital, Dr. Jonathan Samuels, and welcome.
Thank you.
The numbers are startling. 28,000 people,
Yes.
at least since the year 2014. And opiates are really becoming more prevalent these days.
Right. Opiates are the major cause of drug overdoses in this country. In New York City, about 1,000 people died from opiate addiction in 2016, and about a quarter of those deaths were in the Bronx. So it's a very serious problem. A little over half are from prescription drugs. In my practice, I see mostly people who are addicted to heroin.
And when you talk about people who are being prescribed drugs, obviously that's the talk about how do we go about this, how do we deal with this when you have people who are being prescribed this and it's leading to, overdoses. We know that there's some measures that are actually in place. Talk a little bit about some of the measures that are in place in terms of prescribing this.
Right. When you're a physician and someone comes to you in pain, you want to help them not be in pain. Now, in the early 90s, there was tremendous marketing done by pharmaceutical companies, billions of dollars in advertising opiates. And people demanded, and doctors gave people opiates for things that probably could have been treated with other modalities. For certain people, opiates are appropriate. If someone breaks a leg, if someone's had surgery, they will need opiates for a short period of time. If someone has pain from cancer, they probably need opiates for a longer period of time. But people who present with things like back pain or pain from arthritis, we want to find other modalities before we commit them to opiates. And if we use opiates, we want to make sure we evaluate the patient carefully to protect them from becoming addicted. Now, New York State recently put into place a computer program called iStop, where you can go in and see if someone is getting opiates from another provider. So people who have opiate use disorders will sometimes seek out prescriptions from other providers. Also, as of recently, I forget exactly when, you can only send opiates to a pharmacy by computer. So problems with forged prescriptions, stolen prescriptions are less now.
When you talk about the effects, I think people out there are like, well, how bad is it? But there are some real, harmful effects to opiate use. Share with our viewing audience a little bit about the effects of opiate use.
Okay, well, I'm going to talk a little bit about how the brain responds to opiates. There's a part of the brain called the nucleus accumbens, which is the pleasure center of the brain. Now, this part of the brain responds to naturally occurring reinforcers like food and sex, and helps people to engage in behaviors to acquire these things, and that's normal. Now, repeated opiate use also causes changes in this part of the brain, and this can result in these abnormal, almost uncontrollable urges to use opiates. And this is what results in the destructive behaviors that lead to opiate addiction, or that are part of opiate addiction. Yeah,
so Mayor Bill de Blasio is taking some work here, and he's talking about Healing NYC, talking about opiate use. Let's people know a little bit about this here.
I'm sorry?
Mayor Bill de Blasio has the Healing NYC going on. Do you know anything about?
I'm not familiar with that.
Okay, so he's got a part of it is our national leaders are actually trying to take action and trying to deal with some of the things in terms of opiate use and how do we control opiate use. And Governor Chris Christie saw a change for doctors in prescribing opiates and helped with a state law that had about 1,600 drug-related deaths in 2015 alone. New York City, of course, really stepping up. So are you not familiar with any work that's being done in the city?
Well, I do treatment, and I think that treating people with opiate use disorders is very important. And what we do is a two-pronged approach. We provide medical treatment, and we provide psychosocial support. Now, the medical treatment includes things like methadone and buprenorphine, which most people know as Suboxone or Subutex. Methadone has been around for a long time, and it binds to those same receptors that give you that feeling of pleasure and high from opioids. But it doesn't have as much of the sedating effects, it doesn't make people high, and it's legal, so people are not going to get arrested because they're using methadone. Now, methadone has to be prescribed in a federally licensed methadone maintenance center, so it can't be given in a doctor's office. Buprenorphine is a more recent drug, and it can be prescribed in a doctor's office by an appropriately credentialed and licensed physician. It has certain advantages over methadone. It has fewer side effects, it's less sedating, it has fewer sexual side effects, it doesn't cause the same dry mouth and bad cavities that people with methadone get. And most importantly, it's virtually impossible to overdose on buprenorphine, which people know as Suboxone, alone. Whereas methadone, especially in combination with alcohol or tranquilizers, there is a real risk of overdose.
When you talk about the opiates, I know we talked about just a few minutes ago, now you can only get it via computer. So a doctor, you can only prescribe.
Right, you can only
it.
send it to a pharmacy via computer.
Okay, and that seems to be pretty effective. So in terms of changing the treatment options, I know there's consistent talk that's going on right there. How receptive are doctors to say, listen, you know what, we need to change the way that we do things?
I think they're getting more receptive. I think that to a certain extent, the opiate use disorder, cigarette smoking, drug use has not gotten the attention it deserves. We know if someone with heart disease and diabetes has problems, we should treat them. I don't think people understand that opiate use disorder is a brain disease, and that needs to be treated just like any other disease. It won't get better unless you do.
And so for people who want to find out more information, what do they do? If they have somebody that they may suspect is being involved in opiate overdosing and using, what do they do?
Right, there are many methadone programs available in the city, addiction medicine programs. We certainly encourage people in the Bronx to come to our program at St. Barnabas. We offer a multi-pronged approach to treatment. They can access methadone, buprenorphine, there are some other treatments also, as well as be assigned to a certified substance abuse counselor, have individual and group therapy. So it's a two-pronged approach, the medication-assisted treatment and also the support that comes from individual therapy and groups that helps you retrain your brain to cope with stresses in ways that don't involve using opioids.
And before I let you go, are you seeing any particular trends coming through your door here in the borough of the Bronx?
I can tell you most of my patients are older. They're in their 40s and 50s, and they've been using opioids for 20 or 30 years.
Wow.
The younger people that come to me, they seem to have a harder time. Younger people, their executive capacity, we know that younger people are more likely to take risks and feel that they can handle it themselves. So they seem to have a harder time with it. Although I do see some people who started with prescription opioids.
All right. Well, Dr. Jonathan Samuels, Medical Director of Addiction Medicine at the St. Barnabas Health System. Well, thank you so much for coming and sharing with us here. Glad to get this information out there.
Thank you, Daren.
All righty. Well, I want you to stay tuned. We're going to have more show coming up after this. We'll be right back.